Blood donation, according to officials, is not that popular among the adult population in the country, a situation they have described as worrying. The misconceptions about the act, according to officials, affect the targeted pints needed to stock the country's blood bank for emergencies. Head of donor recruitment at the blood transfusion unit of the Konfo-Anokye Teaching Hospital, Kwame Asensu-Mensah, speaks to City News about their difficulties.
There are plenty. Misconceptions of men becoming impotent after giving blood, and so you have women discouraging their husbands from donating blood because they've heard that they will be rendered impotent after donating blood. It's a serious misconception. Some of the women also think that once they start giving birth, they cannot donate blood because it would affect their fertility. People think that the blood that we give is soulish, is spiritual. And so when you give blood, you are giving out your spirit or your soul. And so it is all over. Those misconceptions are, the people even think that once you give blood, you will die. Even if they see people literally giving, they still doubt that they can donate it because they fear that people may die. So the misconceptions are there. But I believe it will take the media and us to educate the people to come to terms with the realities that when you donate, nothing bad happens to you. It is everyday persons like us standing here that give blood.
General Overseer of the Calvary Charismatic Center, Reverend Ransford Obin, has been mobilizing his congregants annually to help stock the blood bank. He is concerned about rising road accidents in the country and believes helping stock the blood bank will save more lives.
We are here for blood donation, and I think for the past almost about 6 years or 7 years now. I don't even remember exact, but it's been long that every year when I'm celebrating my birthday, I try to be a blessing to other people. And I realize that the number one killer in Ghana is accidents. Accident kill more people than any disease in Ghana. And when one accident occurs, the blood that people will need in order to survive is so much. They can empty the blood bank. Just one accident can empty the blood bank. So I realized that I will use this opportunity to encourage people to donate blood, because all of us use car, so we are all at risk. It doesn't matter how careful you are driving. Another careless driver can hit you and you may be in need of blood. That's why I am encouraging everybody to donate blood.
Meanwhile, members of the Muslim Health Workers Association of Ghana have revealed financial barriers remain major hindrance to accessing health care among most inhabitants living in Zongo communities.
We are here today for medical screening in our Zongo community by the Muslim Health Workers Association in collaboration with Alhaji Yusuf Foundation. Yeah, he has sponsored this program for it to become a success. So it's a collaborative activity to screen the less developed communities such as the Zongo, so that we'll be able to reveal some of the medical conditions that are very prevalent within the Zongo communities. Yeah, and then among the screening exercise, we're able to detect people who never knew they had diabetes or hypertension, but we've been able to detect it, and we have referred them to the appropriate hospitals around, or the closest health facilities that is around. Yes, and again, some people also didn't know their status, their HIV status. Alhamdulillah, we are able to detect some of the cases, new cases they never knew. Some of them are really deprived, they don't have the means. Others have the means, but due to ignorance. So we encourage them, we sensitize them, and then they are being encouraged to go to the facility.
For health workers, they are committed to working to address key challenges posing as barriers to health delivery. Officials of the blood transfusion unit of the Konfanyoti Teaching Hospital say a lot needs to be done to stock the blood bank. Hafiz Tijani, City News, Kumasi.